2 and 1. Good evening, everybody, or good afternoon, rather. It's Tuesday, November 15th, Public Health and Safety Committee meeting. And we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 resolutions. And it's all we have is resolutions. They're mostly approving grants or whatnot, so I will keep them on consent unless anybody objects. I will read through the captions here, and yes, sir.
Oh, thank you.
Oh, I'm sorry.
No, you're fine. I just wanted to ask if you could take off 71 and 72.
71.
Which is number 7 and 8.
And 72. Very good. All right, so we shall. RS 2022-1854, Roten, Syracuse, Welsh, Warren, Hauser appropriates $100,000 through a grant contract between the Metropolitan Office of Family Safety and Sexual Assault Center for the provision of medical legal exams and therapy for residents in Davidson County, bless you, who are domestic violence victims. RS 2022-1866, Roten, Syracuse, and Welsh approves a contract between the Tennessee Department of Health and the Metropolitan Board of Health to provide a mobile vaccination trailer to support remote vaccination events. 2022-1867, Roten, Syracuse, and Welsh approves an agreement between the Metropolitan Board of Health and the University of Memphis Lowenberg College of Nursing to provide clinical experience opportunities for its students and residents. RS 2022-1868, Roten, Syracuse, and Welsh approves a business associate agreement between the Metropolitan Board of Health and Siloam Health to provide safeguards to prevent the use or disclosure of protected health information. RS 2022-1869, Roten, Syracuse, and Welsh approves a business associate agreement between the Metropolitan Board of Health and Matthew Walker Comprehensive Health Center to provide safeguards to prevent the use or disclosure of protected health information. RS 2022-1870, Roten, Syracuse, and Welsh approves an agreement to detail for the Public Health Associate Program between the Metropolitan Board of Health and the Centers for Disease Control and Prevention to provide an associate to assist public health agencies in developing, implementing, and evaluating public health programs. RS 2022-1873, Roten, Syracuse, and Welsh approves Amendment 2 to a grant from the Tennessee Department of Health to the Metropolitan Board of Health to improve the health of the citizens of Davidson County through targeted strategies to prevent and control the use of tobacco. RS 2022-1874, Roten, Syracuse, Welsh, and Bradford approves Amendments 2 and 3 to a grant from the U.S. Department of Health and Human Services to the Metropolitan Board of Health to provide for the prevention, surveillance, diagnosis, and treatment of HIV/AIDS and to administer a Minority AIDS Initiative program. All very good stuff.
Move to approve.
We've got a motion and a second. Any discussion on the consent agenda here? All very good stuff, again. If not, all in favor?
Aye.
Against? And the consent agenda passes, so we will go back to RS 2022-1871, Roten and Syracuse. Approves Amendment 1 to a grant from the National Association of County and City Health Officials to the Metropolitan Board of Health to partner with agencies and implement activities that address the community's challenges related to drug overdose deaths. Can I get a motion?
Second.
Very good. Councilman.
Since Dr. Black and Dr. Ryder are here, I wanted to know if you all, because really my questions are about both. I was going back and looking at the exhibits and see the contract extension and that kind of thing. And if you could speak to, since there's, we've lost so many people in that group, how staffing is coming along, and do you think you're going to have everything kind of back up before the contract period ends?
Councilwoman, first of all, we have maintained, luckily, all of the activities that we've been doing through a lot of help and work from others within the behavioral health unit regarding opioids. So we're in good shape there. We did not get, because we haven't spent all the money, we've got more money and we wanted to extend, be able to extend this contract. It's a one-year extension, allows us to go ahead and spend the funds that we've been given, which we want to do. But as far as replacing individuals, we are currently in the process of interviewed a number of individuals for the director of behavioral health. We have upgraded that position and actually are recruiting a clinician to lead that area. And we also have a number of the other positions posted and are working on those. There are a couple that we might want to have the input from the new director on, but some of the others that are a little lower level that we can't can, we're working towards filling those. We've had at least 2 really good candidates, and I would let Dr. Black speak to that because she is actually on the committee that
Yeah.
been interviewing.
Thank you, Councilwoman, for the question. We will complete all of the interviews for the director position this Friday, actually, and hopefully we'll make a decision and an announcement. If not by the end of the week, then certainly the start of next week. So we're really excited about that. Just adding to Dr. Wright's comments, we have not missed a beat in terms of data collection and reporting, so we're really happy about that. It gets a little tenuous sometimes when you're down in numbers, but the staff have really stepped up, and especially from the epi department and all of the behavioral health staff that are still working very feverishly to continue the services. So I think we're in a really good place and looking forward to rebuilding and focusing our efforts to a lot of prevention work, and that spoke to the assessment that the Mosaic Group did. They conducted out of Maryland, an independent assessment and consulting firm. So we've got good directive and recommendations from them, so we look forward to implementing them.
Okay, because I know one of the, and I don't remember which legislation it was attached to, because it did speak to kind of the goals and I guess vision of the previous behavioral health director. Like it spoke about the spike alert system and that kind of thing. And I know that there's been, because I am still getting some, the data from your team, that there's been a couple of suspected overdoses, but to my knowledge, I'm on that system and it's not been activated. So is that something that will come back, with
That
the...
system's actually still active,
Yeah.
and we just haven't had any particular spikes, luckily,
Okay.
that would have set it off. We've
So
had...
we haven't met the threshold.
So
is
we
what you're
haven't
saying.
met the threshold, which
Okay,
is
good
a
deal.
good thing. And actually, year-to-date, even though the numbers have been high, year-to-date, at least we can say we are the same as we were last year. So we haven't, every year before, we've seen a 20-30% increase year-over-year. This year, we're year-over-year are flat for any increases in opioid-related events, whether they're deaths or just calls.
Okay.
So that's the, if there's any good news, that's the good news at the moment. The other thing that we are working on is, as you may know, we're in the process of procuring a EHR, an electronic health record. And as part of that, we're also working on contracting with insurers so that they can help offset, because one of the things we want to be able to do is to take individuals that may be awaiting a bed and see those in the preventive type of situation in a clinic that we set up through mental health, where we can see them routinely to kind of keep them at least stable until they can get into treatment if there's a delay, because a lot of times there is. And so that's some of the things that we're thinking about. The other thing is that we are meeting with the mayor's office because there is a fair amount of the money that has come in for the opioid settlement, and there has been identified an oversight committee that will be meeting in the near future.
That answers all my questions.
Excellent.
Thank you.
Any other comments on this? All in favor?
Aye.
Against? Thank you, council member, for your continued focus on this as Chair Emeritus. RS 2022-1872, Rogan, Syracuse, and Van Rees approves Amendment 1 to an opioid overdose reduction program grant from the U.S. Office of Justice Programs to the Metropolitan Board of Health to address prescription drug and opioid misuse, save lives, and reduce crime through a comprehensive and collaborative approach. Have a motion?
So moved.
Seconded. Thank you. Councilmember?
No, I got all my
You
questions.
got it all in one. Very good. All in favor?
Aye.
Against? All right. That concludes our agenda. I believe Vice Chair Porterfield had a couple questions for our Health Department guests.
Yes, thank y'all so much for coming. Dr. Wright, animal control falls under your purview?
Yes, it does.
Okay, so.
I can't go to a council meeting without having to talk about it a little bit.
Yeah.
Sure.
Just want to make sure. So, and I apologize. Ideally, I would have been able to have this conversation with you offline sooner. But I literally just got this message, I mean, not even an hour ago, about concerns about animal control has been without a dryer for the last few weeks. So I'm not sure if you're aware of this or not. But a volunteer reached out and said that it's been weeks that they haven't had a dryer. They're being told that the part that's needed, I don't know if it's on back order, but it's going to be additional weeks. So at this point in time, there are piles of blankets and towels that are covered in feces that are just out and piled up in trash cans. Volunteers are taking these items home, washing them in their homes, which is kind of them, but disgusting. I was told that the jail is also helping out and cleaning some of these things. I don't understand how that happens. Like, a new dryer is $200, $300. Like, I don't understand why, what's happening. So can you speak to that?
I can't because I don't have any information on it.
Okay.
You know, I can put you in touch. I will put Hugh Atkins, who that reports to, or Ashley, in touch with you.
Okay. Or even better, solve it.
Hopefully we can figure the problem out. But yeah.
That's, I mean, it would be great. I would love to talk to them.
I don't know if that's, I don't know that that's a, whether that's a commercial dryer or not.
Okay.
So that,
There's
I
just
don't
gotta
think
be-
it is, but I'm not sure, which means that it would just be more than a few $100s to replace, but, yeah.
Whatever
Yeah.
needs to happen. I mean, because at this point, they're saying that there's an odor, there are health
Yeah,
concerns.
I'm sure if there's stuff sitting like that, then yes, there is.
Yeah, and they're hanging stuff from ladders to dry and hanging stuff from the ceiling to dry, and that's
I need a
like,
clothesline.
yeah, it's
They need a
just
dryer.
unacceptable. So if you all can handle
Yeah.
it as quickly as possible, thank you. That's it.
Thank you very much. Any other business for this committee? No, we stand adjourned. Thank you all. Appreciate it.
Thank
Bob,
you.
were you here the whole time?
Just his materials.